Now that you're a few cycles into the conception process and likely accustomed to using predictive tools such as ovulation testing and cervical mucus testing, as well as confirmatory tools such as BBT testing, you may be at a crossroads. Are your cycles irregular? Are you seeing some inconsistent patterns with ovulation testing? Is your BBT spike missing? At Premom, our goal is to provide you with all the resources you need to optimize your chances of conceiving naturally. If you're starting to feel stuck in your conception process, it may be a great time to consider scheduling a virtual consultation through your Premom app with one of our fertility specialists. Premom pregnancy advisors come from all different backgrounds, and you can pick the best option for your needs. Our team is comprised of certified fertility awareness method specialists, registered nurses, nurse practitioners, medical doctors, naturopathic doctors, and midwives. A virtual consultation may be just what you need if you are wondering why you still are not pregnant, curious if you are tracking BBT, LH, and cervical mucus correctly, wondering what the next steps are in your fertility journey and what they should be, if you're unsure about your intercourse timing, or if you're just confused by your irregular cycles. A visit with a fertility awareness method instructor provides you with fundamental insights into your chart, discussion of your BBT and LH strips, and cervical mucus observations. They can help to identify issues in intercourse timing, when and how you take BBT, and how you are utilizing ovulation tests. So let's take a moment to discuss what else could be going on with these irregular cycles you're experiencing. PCOS, or polycystic ovarian syndrome, is a common endocrine disorder that tends to present itself with irregular cycles, dark hair growth on the chin, upper lip, or nipples, acne, and elevated insulin levels. If you suspect that this may be an issue for you, consider working with one of our fertility experts or scheduling an appointment with your primary care physician for a deeper look into your hormone levels. They may want to run some blood tests and even check for cystic ovaries using something called an ultrasound. Are your cycles on the short side? Are they less than 10 days between when you ovulate and when your period begins? You could be experiencing a phenomenon called luteal phase defect. Luteal phase defect is a fancy way of saying that a fertilized egg may not be able to fully implant and signal pregnancy to your body before your body begins sloughing the endometrium for your next period. The luteal phase should typically last 11 to 17 days. If the second half of your cycle is shorter than this, it warrants a bit more investigation. Consider working with one of our fertility experts to troubleshoot any errors while trying to conceive, or talk to your gynecologist to identify the cause of these short cycles. Are you missing your LH surge? Hopefully you're using ovulation tests to predict your ovulation and using BBT to confirm ovulation. But what if your LH surge is missing? Some women experience a gradual rise in luteinizing hormone over the course of 1 to 5 days, while other women experience a rapid surge of LH that spikes in a matter of hours. If you can't seem to catch your LH surge, begin using ovulation tests 2 times a day in case you have a rapid LH pattern. Test your LH once in the morning and again in the afternoon for at least 1 cycle. You may also consider switching to Premom quantitative ovulation tests to get a better grasp on your LH levels. We at Premom find best results when LH is tested between 10 a.m. and 8 p.m. and water intake is kept consistent on a day-to-day basis surrounding your testing time. Are you doing everything right? Do you need some reassurance? Maybe you'd sleep better once you've confirmed that you are doing everything correctly for tracking your cycle and timing intercourse. Consider scheduling a visit once monthly for the next few months to help stay consistent with your conception process, to answer any questions that may arise, and to be a continuous beacon of support so that you never feel alone in your fertility journey.